Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Welcome to our press briefing for Wednesday, July the 29th. We are in week 21 of the coronavirus pandemic here in Montgomery County and week 5 in the green phase. Since our July 28th press release, we have 44 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 9,517. These positive cases are a result of a positive test for the virus, not from the antibody test. One of these cases is from a long-term care facility. 43 of these cases are from the community. Of these 43 cases, 9 tests were conducted over 2 weeks ago between July 13th and July 15th, and an additional 9 of these tests were conducted over a week ago during the week of July 16th through July the 22nd. These positive individuals are from 22 municipalities, leaving us with 61 of 62 Montgomery County municipalities home to individuals with COVID-19. These individuals range in age from 3 years old to 68 years old. And you can always check our county map at www.mocopa.org/COVID-19 for updated geographic information. Today, there are 21 females, 22 males, and 1 unknown. I am pleased to announce that we have no Montgomery County deaths to report today, which leaves us at 818 deaths confirmed positive from COVID-19. Overall, 438 females and 380 males have lost their lives to COVID-19 here in Montgomery County. In terms of our hospital beds, pretty much holding steady over the last week. We currently have approximately 52 individuals with COVID-19 hospitalized in a Montgomery County hospital, with 9 individuals requiring a ventilator, or approximately 17%. Our community test sites, all 6 of them are up and running around the county. As a reminder, none of these sites require a car to be tested. These sites do not require an appointment. These sites do require an appointment. All appointments are made the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works in Montgomery County. These county-run sites provide testing at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. The test sites are open at the following locations. Each location has hours that vary each day. The Pottstown location is located at the Montgomery County Office of Public Health at 364 King Street in Pottstown. In Lansdale, the site is at 421 Main Street. There's a site at the Willow Grove Office of Public Health, 102 York Road, and at Green Lane at Deep Creek and Snyder Road. The site in Ardmore is at 114 West Lancaster Avenue, and in Norristown at 1401 DeKalb Street at our partner at the Delaware Valley Community Health Center. To register for a test, you can go online and register for any of these 6 locations. Go to mocopa.org/COVID-19, and under the green County Testing Information button, you'll see a link. Appointments open at 8:30 a.m. on the day of testing. Please note that because we allow only same-day appointments, there is language on the appointment website that says each site is closed for testing tomorrow. Please ignore that language. It's just a glitch in the system, And appointments will open for that site every day, Monday through Friday, at 8:30 a.m., as long as there's not an issue with the weather. Phone registration is also available for all 6 sites at 610-970-2937. That also opens at 8:30 a.m. for testing that day. There are Spanish-speaking operators and also language line translators available by phone. So working together, we have dramatically reduced the viral spread here in Montgomery County, but we are still in this thing, and this is no time to let up. Keeping the spread of virus low will enable our businesses to stay open, our children to go back to school this fall, and keep our hospitals and first responders safe. So let's see how we are doing today. So first, we're going to share our date of test graph, which, as you know, has gotten pretty wide. So we will have a zoom in here on that graph shortly. But as a reminder, the gray bars are a representation of the number of people who tested positive on any given day. And then we have various averages. So the pink and the red lines represent the 7-day and 14-day average of all positive cases. The blue lines are the 7-day and 14-day average of cases from the community. And the yellow lines are, yellow and orange line are the 7-day and 14-day average from long-term care facilities. And you can see that we've made very substantial progress in our long-term care facility numbers. We are down to about, at least with our 14-day average, less than 1 a day in terms of cases from our long-term care facilities. And overall, in the community, our 7-day average is also continuing to hold, pretty stable, very slight increase over the last few days, a little over 1 case, but, overall staying very consistently low. So that is great news. We're going to show you a new chart today, which is the share of total cases by age bracket. And we're sharing this information with you because there's been a lot of interest and questions about the age of individuals who are, as of recent times, becoming ill with the coronavirus. So if you look at this chart, you can see the age brackets, and we're using the brackets that the census uses because that's where our data can connect to. So that's on the far left. Next to that, you'll see the percent of Montgomery County population that particular age bracket makes up. And then you can see the percent of total cases on May the 1st and the percent of total cases on July the 29th. So we've highlighted the 15 to 19-year-old bracket, the 20 to 24-year-old bracket, and the 25 to 34-year-old bracket. And you can see, if we look at the 15 to 19-year-olds, that in May, they were 1.7% of the cases, and as of today, they are 4.4% of the cases. With the 20 to 24-year-old bracket, back in May, they were 4.6% of the cases, and today are 6.7% of the cases. And in the 25 to 34-year-old bracket, back on May 1st, they were 12.7% of the cases, and today they are 13.8%. So we are seeing an increase in the number of cases occurring in those age brackets, but it's not as dramatic as other places have seen. But I will, as I get into some of our reporting from contact tracing today, show you where we think those cases are coming from. And then finally, and most importantly, our positivity graph. So as a reminder, this graph shows in the orange, kind of very jaggedy line, the number of PCR, so this is the test for the virus, the number of PCR tests done on any Montgomery County resident on each given day. And today, this graph goes through July the 24th. The reason we have a 5-day lag on this graph is because it takes a while to get a sufficient number of tests back for the recent days that this positivity number is actually meaningful. So that orange line is a representation of all of the tests that were done on a Montgomery County resident on that particular day. And then the blue line is the percent of those tests that were positive. So you can see, way back at our peak in April, we were running around 28%. And as of July the 24th, we are running 3.46%, which is a slight decrease from where we were a week ago. A week ago, when I presented this graph, the graph went through July the 17th, and we were at 3.54%. So I'm sure many of you have noticed, if you've been following our press releases or our data hub site, which is updated every single day, that the absolute number of cases has been increasing. But you can see from this chart that there are also a greater number of tests being conducted in the county. And so what's important is what percent of those tests are actually coming back positive. And that, as you can see, has been pretty stable now for about a month. So that is great news. Being under 5% is an indication that we are doing a good job of suppressing this virus. And this is absolutely where we want to be and where we want to stay. I think this is an amount of virus in our community that is an amount that we can live with until we have a vaccine available. So our goal is to just stay the course of where we are. So what can you do to help accomplish this? Number one, do not leave home without a mask. Just don't leave home without one. You pick up your car keys, your driver's license, pick up your mask. And also, if you're just going out for a walk in your neighborhood, just keep the mask with you in case you run into a friend or a neighbor and you want to have a quick conversation. Put the mask on for that conversation. Whenever you are within 6 feet of someone who is not in your household, you need to have that mask on. Number two, keep 6 feet distant from anyone who's not in your household. This is really hard to do. We naturally move toward each other when we have a conversation. And I'm constantly finding myself having to take a step back, and then finally say to the person, stop, you're too close. It's just human nature. So we need to be really, really conscious of that. Number three, keep your hands clean and away from your face. Number four, get tested. And number five, cooperate with contact tracing if you test positive. Can't stress enough how important it is to cooperate with contact tracing. These conversations are confidential and non-judgmental. I want to thank everyone because we have seen a big improvement in cooperation with our contact tracers. I want to thank you for that and want to remind you why it's so important that positive individuals share the names and contact information of their direct contacts. When a direct contact who is at high risk of exposure to the coronavirus receives a call, here's what happens. Our contact tracers officially inform that individual of their requirement to quarantine due to exposure. Our contact tracers are able to answer any questions that individual has about COVID-19 or refer them for additional guidance. Contact tracers ask if the individual is able to safely quarantine in their home, and if not, no-cost alternatives are provided. Additional supports can also be arranged, such as help with food delivery or other unmet needs. It's absolutely critical to the suppression of the coronavirus in our region that everyone cooperates with contact tracing. So when you're called, your phone may show any of the following, and these are our partner organizations that are helping us do this work. The organization ACLAMO, which is spelled ACLAMO, that may show up on the phone. Visiting Nurses Association, or VNA, may show up on the phone. Family Services of Montgomery County OIC are also organizations that may show up on the phone, but in both of those cases, sometimes it just says unknown. And that is also the case for the County Office of Public Health due to a technical situation with our phone system. So if you see unknown pop up on your phone, I know none of us want to answer that, But right now, today, if you would consider answering that, that could very well be a contact tracer. When we get good contact tracing, we learn from that information, and then we can let you know what type of activities are putting individuals at risk. And before I give today's contact tracing update, I do want to share an update to a situation that was discussed previously. 2 weeks ago, we mentioned a youth sports coach who did not provide full details to our contact tracers regarding individuals with whom they had had contact with during the period when they were considered infectious. Some media outlets incorrectly reported this story. We asked those media outlets to correct their stories, but we also want to share this correction with you directly. Specifically, this individual did not coach or attend a party after they received their positive test result for COVID-19. We have also now heard back from this individual who did not fully comprehend the importance of providing as much information as possible to contact tracers. They now understand why this is so critical and have agreed to provide all the information they could. And this individual is encouraging others to cooperate fully if they receive a call from a contact tracer. We deeply appreciate this cooperation and support for our community. So here are the types of activities where our contact tracers are seeing spread. First, we're seeing an increased risk of transmission associated with sports and athletic teams. Over the last 2 weeks, Montgomery County's contact tracer providers and the Office of Public Health have investigated individuals who have tested positive for COVID-19 that have actively participated in outdoor sports leagues, including baseball, football, soccer, lacrosse, and field hockey, as well as some indoor basketball tournaments. In the majority of the investigations, individuals were not experiencing symptoms at the time they participated in the sporting events, and therefore didn't know that they were carrying the virus. The majority of these individuals began to develop symptoms of COVID-19 within days after the events, and ranging anywhere from 1 to 3 days, meaning that they were participating while they were able to spread the infection, but did not know they had the virus. During sporting events, individuals who have tested positive have been unable to consistently maintain social distancing, which means that they were 6 feet apart and spent less than 15 minutes, less than 6 feet apart from any other individuals. Because social distancing couldn't be maintained, entire teams have now been quarantined for 14 days. The other place we're really seeing challenges are with social gatherings. This includes parties that have been both indoors and outdoors. We've seen graduation parties, 4th of July parties, and other social gatherings turning into COVID-19 super spreader events. Not only at indoor events, but also at outdoor events, it is necessary for individuals to keep 6 feet of distance between anyone who's not a household contact. An attendee could be infectious and unaware because they do not have symptoms yet. When people are crowding together without sufficient physical distancing, not wearing masks, there is a large risk of transmission, and that goes for indoors or outdoors. So one more reminder about wearing masks. We have had a number of small businesses reach out to us to ask you to please wear a mask inside of all businesses. These small business owners are doing everything they can to comply with existing state orders, including wearing a mask all day themselves. Unless you have a specific condition which would prevent you from wearing a mask, please respect these businesses, which are just starting to get back on their feet, and wear a mask. There are limited exceptions to the mask order, which include those who cannot wear a mask due to a medical condition, those for whom wearing a mask would create an unsafe condition, individuals who would be unable to remove a mask without assistance, individuals under the age of 2, and individuals who are communicating or seeking to communicate with someone who is hearing impaired or has another disability where the ability to see the mouth is essential for communication. Unless you fall into one of those categories, please respect our community. Don't be selfish. Please just wear a mask. We are all in this together, and no one wants to have an altercation over wearing a mask. So please, just wear a mask. It's a simple message, and we need everyone on board with this simple request. So with that, I'm going to turn over to Commissioner Lawrence for some additional updates.
Okay, good afternoon. Thank you, Val. Today I'm going to give an update on round 3 of the Montco Strong Small Business Grant Program. The $10 million available for the third round of the program comes from the Federal CARES Act. And I will remind people we were pleased to award $6 million in the first 2 rounds to 480 small businesses in the county. Round 3 grant awards are once again being administered by the Redevelopment Authority in partnership with the Montgomery County Department of Commerce. Applications opened on Thursday, July 16th and closed at 3 p.m. on Friday, July 17th. Businesses that received round 1 or round 2 Montco Strong Small Business Grants were not able to apply in round 3. And here's a summary of the applications received during the application period. We received 1,924 applications. Of our 62 municipalities were represented. 59% of the applicants indicated they applied in at least one of the first 2 rounds. 51% of the applicants indicated they are a minority or women-owned business. And 4% of the applicants indicated they are a veteran-owned business. And 81% of the applicants reported revenue of less than $1 million annually. After reviewing the applications initially, the RDA has awarded 60 grants totaling $631,500 as of July 27th, and they will continue to review and approve applications on a rolling basis until the $10 million is fully awarded. Grant awardees have been contacted via email by the Redevelopment Authority of Montgomery County with grant contracting instructions. A complete list of the awardees from both this round and the first 2 rounds is available at www.montcopa.org/MontcoStrongSBGP. And as always, we would like to thank the board of the Redevelopment Authority and their staff, and also our Commerce Department staff for all their hard work to get these funds out to the businesses that, as Dr. Arkush mentioned, are working very hard every day to survive and stay open. That concludes my report.
Thank you, Commissioner Lawrence. So with that, I'll announce that our next virtual briefing will be Wednesday, August the 5th at 3 p.m. and be happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Deanna Durante from NBC 10 and Jim Melwork from KYW 1060. We will start our questions with Deanna Durante.
Hello, can you hear me?
Yes.
Okay. I'm just touching base. I talked to you about a few topics last week, if there had been any more discussion on trying to coordinate flu shot clinics, or if the health department was trying to figure out how to get children in the county immunized in a more efficient way than trying to schedule it through doctors' offices. If anything like that's been discussed this week.
Yeah, you know what, Deanna, I don't have an update on that yet, but I will definitely get you that by next week.
Also, social media rumors, and I'm using the word rumors here.
Okay, I'll do my best.
That Governor Wolf is considering making schools go virtual for the first 60 days. It's taking social media by storm. Has the county been notified of any potential changes to school plans?
The county has not been notified of any changes to school plans. I did speak with the Secretary of Health this morning, and she and I discussed this issue. And she conveyed to me that, as has been the practice this whole time, that there would be a collaborative discussion between their office and any county where they had concerns, and that she was unaware of any move to do any sort of blanket order, that it would be, individual collaborative discussions with any counties in which they had concerns about rising case numbers.
So it would be your hope that you would have some heads up on it. It wouldn't just be announced at a press conference and taking people by surprise.
That is what was conveyed to me this morning.
Okay. All right. Thank you.
Thank you.
Thanks, Deanna. Next, we'll move on to Jim Melworth.
I guess stay on the topic of schools. There's been school officials, and I know a lot of this comes from the state, but you've kind of been talking to districts and also kind of an intermediary in some cases between the state and school districts, with school officials basically saying that they feel they're in an impossible position because the guidance from the state, we talked about the 6 feet where feasible, they're getting attacked from both sides, because one side's saying 6 feet, the other side's saying we're feasible, and they just feel like no matter what they do, they're going to get crushed by 40%, half, whatever, of parents, the community, whatever. And they also feel that this isn't their strong suit, that they're not in public health. And you said that there's no blanket statement coming down, but is there a way for either you or the state or someone with a public health background to help them with more strict guidance that would allow them then to pass on their plans to parents?
Well, we've been in regular communication, as I've stated in the past, weekly meetings with our 22 school superintendents. And by the way, I just again want to let everyone know how hard they have been working. I mean, these are real heroes in this moment. Our schools have a really formidable challenge ahead of them. There, I don't think, is a building in this county where there isn't some number of classrooms where they cannot get kids 6 feet apart if they were to have all of the normal number of children that were in that classroom. So, that's kind of where they are starting from. These schools are also trying to balance some very important needs for students, not only just the in-person education, but issues around food and nutrition, the ability to see a nurse. Sadly, schools, keep an eye out and screen for abuse of children. And then there's family situations where parents very much in a number of cases need to be able to go to work. Not every family has good internet connectivity or a device, particularly if they have more than one child in the home. They're trying to balance the needs of teachers and staff who might have underlying medical conditions, as might some students, that would make them susceptible to the coronavirus in a more serious way. And, all of this is coming together in a very, very complicated situation. So we have been providing substantial support to the departments. Myself and members of our Office of Public Health have now met with several individual school boards who asked to have individual meetings just to really go through this. And our role here at the county is to provide that guidance and support. We have conveyed to them that whatever those school boards, and those are the elected school board officials who have the responsibility of making the decision for their individual department, knowing what or individual district, knowing what the composition of their district is. Most of them, if not all of them, have done some kind of polling of the families in that district. It is up to them to make the decision that's best for their district. And we are here to support them no matter what that decision is. So we're starting to see different decisions rolling out from different departments. And we will do everything we can to support each district in whatever decision they make that they conclude is best for their particular situations.
testing, do you know how many tests are being done, or is there kind of an average daily? And is there a breakdown between county tests and private tests? When you show us those numbers, are those all the tests being done, or are those the tests that the county is responsible for collecting?
Yep. So that positivity graph that has that orange jaggedy line, that represents all of the people in Montgomery County that have been tested anywhere. So the county's tests, the drugstore tests, the hospital and Center City's tests, anybody who is a Montgomery County resident, they're in that orange line in terms of the number of tests. So you can look at that graph and get a sense of exactly how many people are being tested each day. And then we see how many of those test positive, and then that gives us our positivity number. And that is deduplicated. So I know that question's been come up before. Once somebody's tested positive, we don't, and there are many valid reasons why people will get tested again, sometimes even more than twice. We don't count them again. So we only count somebody as positive one time.
And this came up a lot early on with the state numbers and the county numbers. When the state, I believe, has a site now that's showing positivity rates, and then your positivity rates, and I haven't checked today or yesterday, but they weren't really lining up. Is that because of the things that we talked about before with how you guys go through each one and kind of pull out duplicates, et cetera?
Yeah, so there's several issues there. One is sometimes there's duplicates on the list. Two, somebody has incomplete address information and they end up getting assigned to the wrong county. So we go through and make sure that everybody that we report to you on is actually one of our residents. You have to really look at what's being reported both on our data and the state's data. Are they reporting date of test result or date that the test was conducted? So our positivity graph, which is now on our hub website, reports by date of test. And that's been particularly important in these recent weeks when we've seen this lag in getting our test results. In fact, at the beginning of this briefing, I called out 18 tests of the number that we reported today that were either over a week or over 2 weeks old. So our positivity number is by date that the test was conducted. So you can see some discrepancies there. I think some of the data that the state is reporting might be by date of test report. That means the day we got the result.
And is the county where would you like the county to be as far as daily tests, and how far, if they're not there, how far is the county from that number?
Yeah. So that's always a really difficult question to answer. I can tell you that as of today, there have been 121,252 total tests conducted on Montgomery County residents, but there are people in that number that have been tested more than once. So that is not a deduplicated number, but that just gives you a sense since the beginning of, well, it would have been, I think it was in late February that our first people were tested. We've tested, there've been a total of 121,252 tests done in the county. So this gives you just a general idea. So in terms of how many tests we should be doing a day, there's been some modeling, and I've looked at this particularly with the Harvard Global Health Group. They have suggested that as long as you're at a place where the virus is fairly well controlled, which is where we're at right now, you should be doing enough testing that you are getting about a 3% positivity rate. So that means that you're testing a lot of people who are testing negative. But when you're doing public health surveillance, that's what you want to be doing. You should be testing a whole bunch of people who test negative in the hopes that you're going to pick up those occasional positives and, get them into isolation and get their direct contacts quarantined. So we're doing enough testing now, and you can see by looking at that orange line on the positivity graph that we have been slowly, steadily increasing the amount of testing that we're doing in the county. And that's not just the county, it's, our hospitals, it's the drugstores, it's everyone who's doing testing. So we're getting about 3.5% positivity rate. So you could argue that we should try to increase our testing a bit from where we're at least with our current level of virus suppression. And the county is very much hoping to do that soon. We have, as of today, signed a contract with Mako Medical. This is a company that is based in North Carolina. And they also have a relationship, and the way that we got connected with them is they have a relationship with a very large integrated physician network here in the Delaware Valley, known as TPIN, the Physicians Integrated Network. And so they already have local relationship, and we're going to be sending our tests to them. And these are the tests from the 6 county sites, hopefully within about a week to 10 days. We have some IT data integration that has to get set up before we can start, but we're hopefully, fairly soon going to be doing that. And they are contractually obligated to a 36-hour turnaround time on our tests. And so that should really, really help us do very robust contact tracing, because we'll be getting those test results back so quickly. And they also have the ability to increase the amount of tests that we're sending them. So we're hoping to ramp that up as quickly as possible and have up to, down the road, it's going to take us probably a month to get there, but hopefully around 100 tests per site per day, Monday through Friday at our county testing sites.
I was getting to the Mako question. And with that kind of, what are you hearing as far as how long results are taking to come back?
Oh, well, I gave you some indication of that with the presentation of today's results. It's taking across the board anywhere from 8 to 14 days. And that goes for Quest, LabCorp, whoever CVS and Rite Aid are using. I think they're using either Quest or LabCorp, I'm not sure. The lab which is BioReference Lab, that does work for the medical provider at our correctional facility. Across the board, it's taking that long. Our hospitals do have a very limited capacity for more rapid testing, but they also end up sending tests out to ones that are less time sensitive. So it just across the board, it's taking that long. And that's just an unacceptable amount of time.
And correct me if I'm wrong, but the county is or was contracted with Quest. Does the contract with Mako affect that contract?
No, we still will have a contract with Quest.
Okay, and some clarification on the youth sports that you discussed. Is there any conversation surrounding the last I recall with youth sports, it was they could be out there as long as they were distances. Has that changed? Can they do games and things where they're closer to each other?
Well, so the thing that's really complicated this is that PIAA, which is the statewide organization that governs the sports for public schools, said that fall sports could start and that schools could begin to call student athletes back to begin conditioning for the fall and things like that. So there seems to be every intention to go ahead and let fall sports happen. Our youth leagues have been playing games, the youth summer leagues, since we've been in the green phase. In the yellow phase, we allowed them to start practicing with social distancing in place. Once we got into the green phase, both the state and us said you can play these games, but you really, really need to be careful. And we advised them to stay socially distant on the sidelines or in dugouts with masks on. And it does not appear that is happening consistently. And of course, when they're actually playing, depending upon the sport, you can't keep socially distant or have a mask on. And so I'm not surprised that we're seeing these outbreaks happen across sports teams. And I just think, parents and families need to be aware of this. And again, it's just another decision to make about whether or not they want their child to be participating in these sports at this moment in time. It is definitely, it definitely carries risk.
And how significant I mean, you mentioned these are happening. How significant are these numbers? Is it to the point where you would recommend revisiting it, or is it just to the point where you're telling parents to be aware that's happening and it's out there?
I think with every decision that we've been talking to families about recently, this is one of those situations where families should do their own personal risk assessment. If a family has a member in that household that is at high risk from serious complications from the coronavirus, so that includes underlying respiratory conditions, diabetes, obesity, or anything that would compromise the immune system, such as a active cancer diagnosis. Those would be examples of conditions that would put a person at high risk. And the same would go for the person playing the sports, if they had any underlying medical conditions that would put them at risk. So if that's the case, a family, I think should just be thoughtful about whether or not they participate or their child participates in youth sports.
So to be clear, then you don't feel that these numbers have risen to the level where it's time to reconsider youth sports?
They have not yet, but we are watching it very, very closely.
Okay, and Mako, that contract, you said you hope to have those tests within a week, or samples going to Mako within a week?
It'll probably be more like 10 days, a week and a half to 10 days. They're working on some back-end data integration between our Office of Public Health and our appointment website. They also have to do some final integration with the state's reporting system, which they're required to report to. So it'll be a matter of getting those pieces in place, and then I think we'll be ready to go. So hopefully, a week to 10 days.
And next question, with these youth sports outbreaks, can you infer anything from that, or is there any way to connect that? I'm sure people will hear that and say, well, that just shows, that we can't open schools because kids playing youth sports are getting infected. Can you draw a correlation between the two, or no?
Well, I think schools can certainly offer all of their academic offerings and make a separate decision about sports. So I don't see those two as intertwined necessarily. A school could choose to be open for academics and not offer a sports opportunity for the fall, for instance.
Oh, I did forget. I've been asking you about rapid tests, and just to ask that, is there any rapid tests that you believe are worthwhile and or available?
Yeah, I don't have any update on that. I think it remains a challenge to have a sensitive and low cost and available rapid test. I don't think we're there yet.
All right, great. I'm good. Thanks.
Okay.
Thanks, Jim. We have no further questions today.
All right. Well, thank you, Megan, for interpreting today, and we will see you all next Wednesday, August 5th at 3 p.m. Thank you.